Welcome back. It's that time of the year. It's Medicare annual election period. Our nation's million veterans over the age of 65 or those who are disabled should be aware of the Medicare Advantage plans that can round out the benefits that they may already have through the Department of Veterans Affairs. Ed Sandrick, the director of the Veterans Channel for Humana, joins me now with some helpful information on how eligible beneficiaries can maximize their 2021 health benefits. Welcome, Ed.
Hi, Audrey. Thank you for having me.
The election period ends on December 7th, and it began, I believe, on October 15th, right? So we're right in the middle of it. What should eligible beneficiaries, including veterans, know about selecting a Medicare Advantage plan for the coming year?
Well, anybody that's eligible for Medicare, particularly this time of year when the choices are important, need to look at the provider networks that come along with the Medicare Advantage plans. Make sure that the provider, your primary care physician and or specialists are in the network, and that the hospitals where they have admitting privileges are also in the network. Seniors typically are on fixed income, so budgets are important. So out-of-pocket costs, beginning with the monthly premium, would be something that should be high on the checklist. Then the downstream costs, as you use the plan, the co-payments, co-insurance, deductibles, and those sorts of things will be important for you to consider as you plan out your Medicare Advantage plan for the year. Medications, many seniors are on medications that they want to make sure that are available in the formularies. So it's good to check the formularies to make sure those maintenance drugs are also included. And then the overall expenses for the year. So as with any forecasting, you want to take a look at your expenses for this year to see what they were and what they may end up to be at the end of the year, and try to anticipate what your expenses are going to be in 2021.
Planning is really important. It's important then that everyone take a look at what they currently have when they're looking for a new plan. Can Medicare Advantage and veterans benefits work together?
They absolutely can. Medicare Advantage can complement the care that a veteran receives at the VA. So they don't interact with one another. There's no jeopardy. There's a lot of myths and misconceptions among the veteran community, particularly veterans that are over 65 and use the VA, that if they enroll in Medicare, original Medicare or Medicare Advantage, they might jeopardize their VA healthcare benefits, which is simply not true. Those that get their healthcare at the VA have earned that. They've also earned their Medicare Advantage benefits. They can work side by side.
Can you give me an example, Ed, of how Medicare Advantage can work along with VA benefits?
Sure. In 2020, Humana introduced the Humana Honor Plan in 27 states. And that Humana Honor Plan was designed with veterans who use the VA in mind. It doesn't have a drug benefit because typically the veterans who use the VA get their drugs at the VA. So the plan is designed without a drug benefit. It is available to anybody that's eligible for Medicare, but once again, it was designed with veterans in mind to round out the care they get at the VA. So I can use the VA providers just like I would normally, and I could use a Medicare plan. The Honor Plan this year in 2021 will be available in 46 states. And it has a robust dental coverage with it, access to an urgent care network, and it's zero premium plan across the country. And this year, our Humana Honor Medicare Advantage plan is recommended by USAA, as all our Medicare plans are this year, and we're very proud of that. USAA has an outstanding reputation in the veteran community for its excellent customer service and commitment to veterans and military families.
All right, this sounds like some real opportunities there for vets to augment what they have, and certainly knowing what's possible is important. How can someone connect with a Humana agent to talk about the plan?
I think we all understand that it's important to try to do things from your home. So using the Medicare.gov to understand what plans are available in an individual's particular zip code area is important, just to kind of do your research. If you need to talk with a licensed agent, which I certainly would recommend, so that you'd have somebody who could understand what your current needs are, what your anticipated financial situation might be, it'd be great to talk to a licensed agent. So if you go to humana.com/Medicare, see what plans are available within the Humana portfolio, and simply push a button while you're there and get connected to a licensed agent. or you could dial 1-800-213-5286 and talk to a Humana licensed agent.
So it's just a reminder, and for veterans in particular, that there is a Medicare Advantage plan that will work with your VA benefits. And it's always important to know your options and do that research. Ed, if you'll give us the information about where to go for more one more time, please.
Sure. The Medicare Plan Finder at Medicare.gov. As I mentioned, Medicare does a great job of laying out all the plans available in somebody's zip code area. Or 1-800-Medicare is the 800 number. Or you could go to Humana.com/Medicare and get connected with a licensed agent that way.
Ed Sandrick, Director of the Veterans Channel for Humana, has been my guest. Thank you so much for joining me, Ed. It's always good to see you.
Thank you. Good to talk with you again.
And there's more to come on Talk with Audrey. I'll be right back. You're watching Talk with Audrey. Welcome back. In the U.S., as many as 170,000 people are living with a group of bone marrow disorders called Myelodysplastic syndrome, or MDS, in which the body doesn't produce enough healthy blood cells. My guests today are Dr. Carolyn Behler of Pacific Hematology Oncology Associates and Tracy Iraca, the Executive Director of the MDS Foundation, and they have information about a new treatment option approved by the U.S. Food and Drug Administration that may help reduce and eliminate frequent blood transfusions. Welcome.
Thank you.
Thank you.
I appreciate both of you joining me. Dr. Behler, how common is MDS and what are some of the risk factors?
MDS is estimated to occur in about 5 people out of every 100,000 in the U.S. annually, but that's really an underestimate. And in terms of risk factors, age is one of the most significant risk factors. So the average age is about 70. The risk of MDS in patients 70 or older goes up to 50 to 80 per 100,000 people.
And what are the symptoms?
MDS, or myelodysplastic syndrome, as you said, it's a bone marrow disease that leads to low blood counts. The most common blood count affected is the red blood cells, so that leads to anemia. And anemia causes fatigue. It can cause shortness of breath with exertion, for example, having difficulty going up stairs or a hill, sometimes lightheadedness or dizziness. But it can affect the other blood cells, so low white blood cells can lead to risk of infections as well.
Well, you have to have a really good relationship with your doctor because it sounds like those symptoms could possibly be mistaken for something else, right?
Absolutely. That's a common problem.
And in terms of actually living with some of the challenges that are faced by people with MDS, Tracy, what have you heard from members of your foundation?
Sure. So there's the physical challenges that Dr. Behler already mentioned, but there are a lot of emotional challenges as well. It's really frightening to be diagnosed with a disease that you've likely never heard of before and don't know much about. So the best thing that we can do is we can connect patients with the proper specialist. That's first and foremost, to make sure that they confirm their diagnosis, and then also to offer emotional and educational support through the resources of the MDS Foundation.
And Dr. Behler, what about treatment options? How has it been treated previously? And then if you tell us all about the new treatment option that's been approved by the FDA.
Of course. So the most immediate way to improve anemia for someone who has severe symptoms is a red blood cell transfusion. But long-term, that's not a great strategy. There are other complications like iron overload. Transfusions can be difficult for patients to get to. They take hours. So we try to avoid that. And the first line treatment for anemia from MDS is a booster shot. It's a hormone called EPO that can be injected once every 2 to 4 weeks. And that can be very helpful for some patients, but some patients won't respond. Or some will respond and will be able to stay on those shots for months or maybe even years, but eventually it stops working. So before this year, those patients had to go on to more intensive therapy or red cell transfusions. But in April, a new drug was approved called Reblazeal, which is also an injection once every 3 weeks. And it can help those patients for whom EPO is no longer an option.
Wonderful. Science is absolutely amazing. And that we keep trying new things, new treatments, new possibilities to improve the life condition of people living with diseases. Would a person's doctor be aware of this new FDA-approved treatment option, or is it something that a patient needs to speak with their doctor about?
Well, I think the most important thing is that patients are seen by a specialist who sees myelodysplastic syndrome patients regularly. So MDS experts are aware of this drug, but patients should be referred to a hematologist who specializes in bone marrow diseases.
Tracy, the MDS Foundation, I'm sure, has a lot of resources available. What can people find if they call and or go to your website?
Great. Yes, we do. We have multiple different resources available. We have a patient liaison on staff who answers phones, emails, queries through social media. She talks with patients and actually families and caregivers on a regular basis with doing the connections to specialists, but also to make sure that emotionally their fears are managed and that we know those patients are getting the right education and information. So on our website, which is mds-foundation.org, we offer handbooks and animated patient videos, webinars on demand. We offer the ability to sign up for information about our resources in case you want to join a live webinar. We have families and patients joining those webinars and talking directly with doctors like Dr. Behler to ask their questions to get them answered live. So lots of good resources available through the foundation.
And Dr. Behler, where can we go for information about Reblazeal?
So you could look it up, Reblazeal, REBLOZYL.com. There's a patient and healthcare professional part of the website, so just go to the patient website and there's a lot of useful information there.
Well, I always say informed empowered. Thanks so much for the information. And guys, if you need any additional information, be sure to check with your doctor and or healthcare provider. Check out both of those websites and see if this is an option for you. Dr. Carolyn Behler and Tracy Iraca, thanks so much for joining me.
Great. Thank you for having us.
My pleasure. And I'll be right back after this. Hi there, I'm Audrey Adams. Do you want to live a better, healthier, and more financially secure life? If so, then Talk with Audrey is for you. I talk to experts from a variety of fields. We'll talk about your financial life. We also delve into health and aging, and of course, business. You can get the benefit of all these interviews and so much more. Just watch Talk with Audrey right here. And if you need more information, either about me or the show, visit my website, talkwithaudrey.com. Tell your friends, your neighbors, your coworkers, everyone you know to join you in this pursuit of a better life. Watch Talk with Audrey. You're watching Talk with Audrey. Welcome back. Many find the holidays to be the most stressful time of the year, and if you aren't well prepared, you can find yourself overwhelmed before the festivities have even begun. But believe it or not, with a few simple tips, the holidays can be stress-free. So whether you're traveling to visit family or preparing your home for holiday festivities, our lifestyle and entertaining expert, Brooke Parkhurst, has tips to take some of the stress out of the holiday preparations. Hi, Brooke.
Hi, Audrey. Thanks for having me.
All right, first up, travel. What tips do you have for families that may be traveling for the holidays?
Yes. So if your family is like ours, we're going to be hitting the road for part of the holiday season. And I love an all-in-one site like booking.com. Essentially, they help me from beginning to end. So I book my car rental with them, the hotel, and they even keep me up to date on COVID-19 restrictions for me and my family. Right now, and during their Black Friday sale too, they have thousands of deals with 30% off or more across the U.S. So they're a great resource. And once again, right now, they're offering amazing deals, better than ever.
And can you share some ideas on holiday decor and making decorating easier?
Yeah, today we have the ability, we're just mid-November, so we can go into our closets, see what decor we have from past years, decide what to keep, decide what to toss, and also see what tools we need. For that, I love going to Ace Hardware. Ace is the place for everything and all of my holiday needs. And my holiday decor, like these lights. The kids go nuts. We have an 11-year-old and a 5-year-old, and it's all about the holiday lights. They have the incandescent lights, LEDs, nets, string, colored, white lights, just an amazing selection. And now when you're watching the sales in November, you can get 20% off their Celebrations LED line. So that's a great resource for all of us decorating our homes inside and out.
You are always so organized. So how do we take the stress out of preparing traditional holiday meals?
Yeah, even someone like myself who loves to cook and married to a chef, I agree that holiday meals can be stressful. I thought we had every gadget under the sun until now. I just discovered with my husband the Weber Connect. So essentially, it's your step-by-step grilling assistant. It turns our ho-hum grill into a smart grill. It has Wi-Fi access. So if I, throw a roast on the grill, I can go off, wrap some presents, tend to the kids, watch TV, whatever it may be, and then it'll alert me and tell me when the roast or the steak is done. It's incredible and something that I'm loving for myself, and then I'm going to love to gift a different one. I'm going to love to gift to the foodies in my life.
And of course, Brooke, the holidays can be expensive. How can we spend wisely without breaking the bank?
Well, Audrey, you and I are talking about sales, so let's always be mindful of what sales are going on in the months of November and early December. That's one way. But then also even watching what kind of credit card you're using. I'm loving PenFed's Power Cash Rewards Visa Signature Card, okay? I'm an Honors Advantage member, and that means I get 2% cash back. I could earn 2% cash back on all that I spend. So if I'm buying all these presents and spending some money, at least I can earn some back. There's no cap, no gimmicks, no limits. You can apply today. I can apply today for another one. It's a wonderful resource for my holiday spending and my holiday budgeting.
And of course, where can we go for some more information and tips?
Yes, for all of my holiday tips and tricks, you guys can go to betterstuffforlife.com.
Happy holidays, Brooke.
Thank you. Happy holidays to you.
And that's it for this week's show. I'm Audrey Adams. Join me here next week for more insightful, intelligent, and inspiring conversations and information on Talk with Audrey. I'll see you next week.